So dental implant failure, although not particularly common, there's studies, and I won't bore folks with the studies, but 5%, 8%, depending on the part of the jaw that we're talking about. The lower jaw is usually a little bit more robust and resilient, so the implant failure rate in the lower jaw is a little lower. But if an implant starts to exhibit signs and symptoms of inflammation or pain, those are usually the indicators that something's going on. And when an implant fails, much like your natural tooth, the patients will come in, they'll have pain, discomfort, bleeding, and we'll take x-rays, CT scans to evaluate what's going on. Sometimes if we catch things early, just like if you catch things early with a tooth that might have some issues with it, we can intervene, try to resolve that peri-implantitis, as opposed to periodontitis, which is associated with natural teeth. We can intervene on that peri-implantitis and try to retain that implant. If a significant amount of bone is lost around the implant, that usually requires removal of the implant. Investigation into why the implant failed. Was the crown that was on the implant, was it too large, or is the patient a brux or a grinder? Do they grind their teeth and they didn't have a night guard to keep pressure off of the implant? So we want to address those issues before we go back and replace the implant for them. And the implant can be replaced. We have to remove the failed or failing implant, clean out any unhealthy tissue and bone, regraft the area with cadaver bone, or depending on the size of the defect, different types of bone, and then go back in several months later and replace the implant.